When you're working with patients and their family members, how do you get that buy-in and create to where, because I remember there'd be times where I actually remember a man saying, "There's that woman who comes in and takes away my water." And I was like, "I don't want to be that person." So how
Mhm.
do you get that buy-in and have where you can feel like you're the professional making recommendations that are best, but also, having the family and patient understand why you're making those recommendations?
Mhm. Yeah, in outpatient, I feel like it's a very different ball game because they're coming to me from their home where I am not, and I am not there to, slap their wrist if they reach for that cup of like unthickened whatever. And that's definitely not who I am or what I want to be ever in their mind. So if they come in and their prior level of care is recommended, we'll say like nectar thick liquids, for example. So I'm going to ask them if they're drinking that, or, I'm going to ask them, are you drinking regular water? If I say thin water, they're like, what's that? Why are you being redundant, Leigh Ann? So I'm like, like regular liquids. Are you thickening everything to nectar? And I like to ask in such a way so that they know they're not going to be judged and I'm not going to shame them for whatever their answer is. I just genuinely want to know. And at least I hope people are mostly honest with me. And so if they tell me something that they think I don't want to hear, like, oh, yeah, I can't stand to thicken my coffee. So I still drink that regular. I don't thicken the coffee. I'm like, okay, how's that going? Have you noticed any difficulty, any coughing? Like, how long have you been doing that? I ask how long they've been doing that. So if it's been like 4 or 5 weeks that they've just been drinking regular coffee and they've had no adverse pulmonary effects, that's a pretty good indication. Like, I'm happy with that. And I'm definitely not going to be like, you need to be thickening everything. You could be getting aspiration. Like, I am not going to fear monger my patients. What I will do is provide them with the information and education for them to make informed health decisions on their own. I want them to know like what their risk level is and all of that. So I find that they come in and they're usually pretty motivated, but they're also in their own sphere, their own world. So they are the captain of their ship again, and they can do what they want when they're at home. So really, I don't do diet policing so much. I do exercise policing. I'm like, have you been doing your exercises? No? Well, tell me, what's getting in the way of that? Let's problem solve. Let's try to make it more conducive for you to complete X amount of exercises that I believe would help you in your recovery. So,
Well, and sometimes it really does come down to a quality of life issue. And I had some patients that were like, I'm this old, I know the risks, and I want my water, I want my
mhm,
coffee. And
mhm,
I'm not, and so, I work with kids where the parents can police them
mm,
and make sure that they're doing what they need to. But with adults, you're right. They're adults,
yeah.
and we can make those recommendations and say, this is what I recommend. These are
Mhm,
the potential consequences if not,
mhm,
but
mhm.
ultimately
Yeah,
you get to make the decisions for your own life.
yeah,
So,
yeah. I believe in that autonomy. I believe that they have the right to make that decision, and it's my job to give them the information to make the best decision for what their values are and what
mhm,
outcomes they want to see happen.
yeah.
Yeah, absolutely. I mean, I think that social emotional piece in there with the dysphagia therapy is huge because it is a huge quality of life thing. And so, like, as a therapist, our job is to give the education and the tools, and then it's the patient's decision on how they follow through with it and what really their values are. I love that you said, doing value based therapy because really that allows them to make decisions that align with their values, and then they can take a risk assessment with your help on what that looks like for each thing. So that's great. There's, I'm sure, all different types of outcomes, especially when giving a patient out autonomy in this outpatient setting.